Heights Animal Hospital. I'm here to answer some of your questions about dogs and cardiology, or dogs and their hearts. Um, what does dog cardiology entail? Cardiology is the study of the heart, and it can also involve the lungs as well because they're connected. And typically, it involves a physical exam, x-rays of the chest, and an ultrasound of the heart called an echocardiogram. What is a dog cardiologist and how can my dog see one? A dog cardiologist is a specialist, a veterinarian who has specialty training in the heart and has advanced techniques, knowledge in treating those conditions. You can see one through a referral. We can place a referral to you. There are several options in Charlotte where we can have you see a cardiologist and get an opinion with them and some testing to see what your pet needs. What are the most common cardiovascular conditions you see in dogs? The most common one is going to be a mitral valve regurgitation or a heart murmur with the mitral valve. Very common in small breed dogs like Chihuahuas, Poodles, Shih Tzus. In large breed dogs, we can see heart murmurs as well, but one of the big ones is dilated cardiomyopathy, or DCM. Are certain dog breeds at risk for heart conditions? Yes, in general, small breed dogs are more at risk for heart murmurs, like mitral valve, or might have heart birth defects where you might have stenosis or narrowing of a valve, like the aortic valve or the pulmonic valve. Large breed dogs, especially purebreds, but large breed dogs are more prone to a genetic condition. It can be genetic, dilated cardiomyopathy. Boxers, Dobermans, and German Shepherds are very prone to it. It's been bred into the line over the years. So we see that commonly in those, not commonly, but we see those more commonly in those breed than other large breed dogs. How soon should I bring my dog in to see a veterinarian if I suspect they have heart disease? Very soon. If your dog is acting normal, schedule an appointment with us. If your dog is struggling to breathe, can't lay down, gums are blue, you need to call us and bring your dog in right away. Can my dog have a heart attack? A heart attack in the human field is when there is a blood clot that blocks off blood flow to the heart. Typically, those don't happen in animals. Dogs typically have chronic long-term heart issues that can look like a potential heart attack, but it's not a technical heart attack. Will cardiovascular conditions decrease my dog's quality of life? They can if gone untreated. A lot of our dog, like murmurs, can be managed very well with medications. And the sooner we get the pet on the medications and monitor the murmur and get things treated, the longer they will live. Like with dilated cardiomyopathy, it can be very hard to diagnose, but if we can diagnose it early and get those pets on medications and help them, the longer they will live. Unfortunately, there's nothing we can do to stop dilated cardiomyopathy. In the human world, when you develop dilated cardiomyopathy, typically a heart transplant is part of the conversation. We don't do those in animals, but by putting them on medications, they can live longer, happier lives. What is congestive heart failure and how does it affect my dog? Congestive heart failure is kind of the end stage of a heart disease in dogs. It's the point to where the body can't compensate anymore. Fluid starts building up in the chest, in the abdomen, in the lungs. The dog, the pet can't breathe. They might have blue mucous membranes or gums. Heart failure, when you start reaching congestive heart failure rather, a lot of times medications aren't as helpful as if they were before we got to congestive heart failure. What role does diet play in managing my heart disease? There are some heart healthy diets out there that are prescription. We recommend them. It's just based on each pet's situation. In general, a low-fat diet with exercise is good for your pet. Getting the weight off your pet, if they're obese, can help just the pressure on the chest and the lungs in general. Some common signs of heart disease in dogs is a chronic cough. They might have a high heart rate. They might have a high respiratory rate. They may not be as active as they once were. They might tire easily. What are the warning signs of a dog dying of heart failure? Their mucous membranes or their gums are blue. They might have an enlarged abdomen. They can't settle down. They can't lay down. They can't rest. They have to sit up because the heart is so large and there's fluid that when they lay down, they can't breathe comfortably. And sometimes dogs can just suddenly pass away from heart failure. They might throw a clot, or it just might be so advanced that we can't see it on the outside, and you might just suddenly find them passed away at home. How long can a dog, oh, wait, hold on. How will a veterinarian go about diagnosing heart disease and other cardiovascular conditions? First, with a physical exam, looking at heart rate, respiratory rates. We take chest x-rays. We also, on all of our blood panels here, we do something called a cardio-pro-BNP, which is an enzyme that tests for stretch of the heart muscle. When that's elevated over a certain level, that really indicates that something could be going on, and we will stress that the pet needs chest x-rays, possibly a referral to a cardiologist for ultrasound called an electrocardiogram. We also test blood pressures and an ECG, which is where we look at the electrical conductivity of the heart to see if there's any abnormal findings or tracings on the ECG or EKG. What is treatment for congestive heart failure in dogs? Medications. A lot of times we put them on several medications to help the heart, help the blood pressure, and a lot of times a diuretic to help pull fluid off the body. When a pet does reach congestive heart failure, they will advance quicker than if they're not in congestive heart failure. And we have medications we can add in over time, but at some point in time, medications will stop working and we'll have to consider quality of life with the pet. How long can a dog live with congestive heart failure? True congestive heart failure, not long, once they're very clinical. If they're not very clinical, have mild symptoms, dogs can live many years if on the right medications and managed correctly. What types of preventative care can help my dog avoid cardiovascular issues? Most cardiovascular issues are going to develop no matter what we do. It's just part of the pet's life, especially if they're prone to it, like small breed dogs with murmurs or large breed dogs with dilated cardiomyopathies. One thing is we do not recommend grain-free diets. When grain-free diets hit the market a little while ago, we started noticing that there was an increase in diagnosing of dilated cardiomyopathy, especially in your large breed dogs. And we have found over time that the amino acids in grains are essential to large breed dogs' heart health, and the lack of those amino acids found in grains can actually increase the incidence of dilated cardiomyopathy. And we've actually seen that here at Catawba Heights Animal Hospital. People think they're doing the right thing by putting their pet on a grain-free diet because it's what the commercials say or the pet food stores are advertising. And actually that's incorrect. The pets do need grains, some sort of grains, to lead an active, healthy life and to have a happy, healthy heart. And once a pet develops dilated cardiomyopathy from a grain-free diet, we can't reverse that. So one essential thing is to make sure your pet is getting grains daily in their diet. Do you have any advice on how to comfort a pet with congestive heart failure? Get them on the right medications, get them treated with their veterinarian, and just listen to your pet. Let them do what they want to do. Don't push it with exercise, excitement, that kind of thing. Follow their lead. When you're exercising and they sit down and they're tired, go home, they're done for the day. If they start coughing a lot, can't catch their breath when you have people over, maybe we put them in a separate room or limit people that are coming over just to decrease their excitement. Do medications for heart conditions in the dog have any side effects pet owners should know about? Yes, some medications, mostly your diuretics, which are what we commonly called fluid pills, will cause your pet to drink more and pee more because it's forcing the body to pee out all the fluid that's building up. So it makes them feel like they're dehydrated. So you will see more drinking and peeing, but it will pull the fluid off the chest or the abdomen, depending on where it is, and allow them to be more comfortable. So it is a side effect that most people are okay dealing with as their pet's feeling better. How often should my dog be checked by a veterinarian if they have a heart condition? At minimum once a year, ideally twice a year, at least chest x-rays once a year, blood work once a year. That it also includes the cardio-pro-BNP and probably an echocardiogram and ultrasound with a specialist once a year. Can exercise benefit my dog with heart disease? If so, how much? All exercise is good for all pets, but you need to follow your pet's lead. When they stop and they get tired or they're panting more or their heart rate's elevated, you stop, take a break, they're done for the day. Just follow their lead. What are long-term care needs for dogs with heart conditions, it's going to be medications daily to twice a day. And these pets also probably would benefit from a home boarding situation as opposed to go into a boarding facility due to the stress that we would put on the heart from the pet being stressed. Um, but just daily medications is typically long-term care needs, along with annual blood work, x-rays, and possible ultrasound of the heart. If you have any questions regarding dogs and cardiology and your dog's heart, please give us a call at 704-827-0616.